urban MEAG with long pulse duration. Now, if you look at the resurfacing indication, do we need a mic? Is it okay with that? If you look at the layer resurfacing indication, it will lie under one of two groups, either the photoaging or the scarring. Photoaging like wrinkles, papular estosis, solar litigens, and clinical eyes. And this is going to be more evident in fair skin population. And the scarring like the acne scar, chickenpox scar, post-surgical and hypertrophic scar, and this is going to be more in dark skin population. Now, for the first time, we have a laser which is an urban MEAG laser, but instead of thinking of laser physics, how many joules, what's the pulse duration, you have the choice of selecting, do you want ablation only or ablation and coagulation? I need ablation only. Okay, how many microns do you want to ablate? And then you select starting from 4 microns, 10 microns, 25 microns, up to 100 microns. So you can select the depth of ablation by microns. If you need coagulation, also you can select how many microns you want coagulation inside the tissue. So for the first time, we can forget about all this laser physics and we select a clinical parameter. And according to our knowledge and the chart I showed, then I want to work on the cheeks. The cheeks, I know that the epidermis is 150 microns and the dermis is 800 microns. So I know how many passes I will do. And then I select how many microns I want to ablate and how many microns I want to coagulate. So life became much simpler for us. And then there was a procedure developed called microlaser peel. This is dealing with superficial pathologies. We achieve partial to full epidermal peel. We just remove or ablate 20 to 50 microns per session. We need only topical anesthesia and the downtime is 3 to 4 days. This is a short video about the procedure.
We're going to be giving Diane a 20 micron laser peel, which is a level 1.
This is a 20 microns.
Start very simply. Diane's already put on Elemax for 20 minutes, and this is what it's like. It's going to make a fairly loud sound.
So this is ablation of 20 microns of the skin using the spanner.
Diane, does this hurt at all? No, not at all. Okay.
This is the smoke evacuator, which is important with urban MEAG and CO2 lasers.
The most important thing to notice is that it is not painful, that it's being done entirely with topical anesthesia.
So the pattern can be changed according to the region.
Upper lip and the vermilion a little bit better.
after good cleansing of the face, we start to adjust the device. So can you, yes, exactly. Now we have three options here: the arm, the fiber, and the BBL. The arm will give you also different choices. The fiber is for the lipolysis and the endovenous treatment. The BBL for broadband light, for different IPL options, and for the skin tight. But as long as it is not in the device, so it is not highlighted, you cannot go to that. So we go to the arm, which is the current application. With the arm, there is the contour TRL or the Pro-Fraction, which we are going to use. There are other options like treatment for acne or 1064 for hair, which is not active in this device. So we go for that. We have to press. It's aligning. It will make a self-test to make sure that everything is okay. So this is the الألف 64 اللي جاز ممكن تشتغل 1064 you can add a 1064 and you can add Alexandrite 755 for hair removal. You can, it's different modules, so it's an option to have everything in the same device. So now it's ready. We have to select between the micro laser peel, which we are going to end the treatment with, or the resurfacing. The micro laser peel is not having a coagulation option, so it's only ablation. The resurfacing is having both ablation and coagulation. Then single spot, where you can use the scanner or the handpiece for small lesions. You have different spot size, 2 or 4 millimeters. And then the Pro-Fractional, which we are going to use. This is the ablative fractional. With the Pro-Fractional here, we have to select the level of ablation. How many microns we need to ablate. Usually, in most of the cases, we'll be selecting an ablation depth of 100 to 150. Okay? For her, because the pathology is not severe, it's only mild, and because of the Asian skin type, which is prone for hyperpigmentation, I'm going to work on 100 ablation. After that, we select the coagulation. We can go to coagulation off where there is no coagulation. But when we need collagen shrinkage, we need the minimal degree of coagulation. So we go to coagulation level 1. If the pathology is deeper, then we go to coagulation level 2. If it is too deep, then we go for 3, but I don't recommend it in darker skin types. This is how we select. After that, we select the percentage of skin coverage, surface coverage. And usually, we do either 11% and do 2 passes, or we do 22% and 1 pass. So for the sake of the speed, I'm going to go for 22. So those are the options. After that, we are going to select the area of coverage, which is ranging between 8 to 1. This is what we use if I want to treat linear hypertrophic scars or stretch mark or small acne scars. So this is the smallest one. And the largest one is going to be used when I'm going to treat a large surface. Like for example here, we are going to treat the whole cheek. So I go for the largest spot. That's it. So we selected the parameters and then yes, 100 microns. And then this is we start the treatment. You will feel, something like the skin. We slightly stretch the skin, and then we start the treatment. try to apply the pulses beside each other without overlap. And as you can see, the skin is very well covered. Sometimes we see pinpoint bleeding, and this will be related to the depth of ablation we are selecting. The deeper we go, the more the bleeding is. So this is going to be the last square on this side. And I think